Hi, I'm Magesh. I run the Women's Health program here at Physionique, and I'm going to talk about some of the common conditions that women present with at the clinic. First up is stress incontinence. Stress incontinence is the inability to control the leakage of urine during certain actions like coughing, sneezing, running, or even laughing. Stress incontinence is caused by weak pelvic floor muscles, and these are the muscles that support the bladder and the pelvic organs. These muscles tend to weaken during pregnancy and childbirth. So what do we do with someone who comes in with stress incontinence? Well, first up is a thorough assessment. Based on the assessment, we come up with a specially tailored exercise program that will be progressed accordingly as well. Now, in addition to the exercise program, we also use the ultrasound machine, which is the machine you see in the background here. And this is the same machine that is used for scanning images, but we use it a little differently here. Women can actually see their pelvic floor muscles in action while they're exercising. So this gives them the added advantage of isolating and training a very specific band of muscles. So the exercise program becomes a whole lot more efficient and effective. This in turn gives the women a much higher chance of achieving optimal results. The second thing that I want to talk about is diastasis recti. Now this is actually a gap that forms between the left and the right bands of the abdominal muscles. This gap is present during pregnancy, and it will actually widen as the pregnancy advances. This is normal because it's just creating space for the baby to grow. So if it has been 3 months or longer post-delivery and women are still complaining that they look pregnant or they have persistent backache, then the diastasis may be a problem. So how can we help? Once again, after a thorough assessment, we come up with an individualized exercise program that will also be progressed accordingly. The program aims to narrow down the diastasis or the gap. What we're looking at is trying to isolate specific layers of the abdominal muscles. So once again, the ultrasound machine becomes an extremely useful tool in helping to guide women to exercise optimally. The final area that I want to touch upon is posture and back care in pre- and postnatal women. These women have a much higher chance of developing backache, so they have to be extra careful with their postural habits. This may be due to the pregnancy hormone called relaxin. Relaxin, as the name suggests, relaxes and stretches out the pelvic ligaments in preparation for childbirth. Unfortunately, it does not just target the pelvic ligaments, it actually affects the ligaments all over the body, including the spinal ligaments, which become lax and overstretched. Moreover, relaxin stays in the system for about 5 to 6 months after delivery. So here at Physionique, we focus on postural awareness and good postural practices. We also use various techniques to treat backache, which may result from poor postural habits. So in conclusion, if you have any of the issues that I have talked about, please do give us a call and let us help you.